everyone. I am Victoria Valdez from Trice Energy Counseling. I am the owner. And today we are going to spotlight Sofia Calderon because at Trice Energy Counseling, we are taking advantage and just really honoring, highlighting local Spanish-speaking Latinx therapists. And I get the privilege today of actually featuring Sofia because she's also works for Trice Energy Counseling. And so I'm super excited to have her. So Sofia, please go ahead and tell us about yourself.
Yeah. So as Victoria said, I am an independent contractor at Trice Energy Counseling. I'm a master's level counselor, so that means I'm not quite yet licensed, but in the process of that. And I work primarily with children ages 3 to 10 and their families using play therapy.
Awesome. I get excited when I hear about play therapy because I also do play therapy and I love it. I think it's such a great tool. And I also think it's really cool that you have the skill set like to work with, and the patience, right? To work with the ages as young as 3. I think that's super exciting. Mine is about 4 or 5. 3 is a little for me like, oh. So I love that that you're doing that. I feel like there's not a lot of clinicians out there who see as young as 3. So that's really awesome and encouraging. So yeah. Tell us a little bit more about your licensure field. Kind of like you talked to, there's so many, right? Like I'm a licensed marriage and family therapist. Your LPC. Tell us a little bit about that.
Yeah, so I just graduated from Lipscomb University with my degree in clinical mental health counseling, and that's where I got my specialization to work with kids using play therapy and expressive arts. And so I will be seeking LPC and MHSP designation. So that just means my scope of practice is just a tad bit bigger. I can diagnose, and I just have a lot of areas that I can work with. So yeah, that's a little bit about my license I'm trying to achieve at some point.
Awesome. I always like to tell people when I was working towards my licensure for a marriage and family therapist that it's like a residency, right? Like a doctor residency where doctors are seeing patients while they're, working towards their full-blown doctor status, right? So I think it's really exciting. I also loved hearing the mental health, you called it MH, right? LPC, MH. I call them a tracks, right? Like and that kind of experience and the play therapy. So that's super exciting. Did you take you mentioned you had special education on play therapy. Did you receive that there at Lipscomb?
Yes, I did. I was lucky enough to be able to get that during grad school, and I continue to receive training. I just went to a training on Saturday about play therapy with families. So I'm continuing to expand my scope of practice and getting to work with not just the kids, but the families as well, because that's important.
Awesome. Yes, super. I love when other therapists have really value and appreciate or have training on the value of the whole family system. Since I'm marriage and families, right? We do a lot of our lens training was a lot on family systems, right? And so that's super important. I also did 80 hours worth of training at Lipscomb. That's where I got my play therapy training was at Lipscomb with the course that they were already providing. They had opened up to the community of other therapists to be able to join. So that's really cool. It's such a great program.
It's awesome. It's amazing. I loved every minute of it.
Yes, super amazing. I was like, oh my gosh, it's the best training ever. It was super good. I was going to say, so tell me, Sofia, how do you help people? You talked a little bit already about your specializations, but what exactly when you work with clients that are children and families, like, is there anything that you go, wow, I really focus on working on these areas, or any specializations really is what I'm looking for?
Yeah, so that's kind of like a twofold question for me. I have experience during my internship during grad school working with victims of crime, and like 65-70% of my caseload were Spanish speakers. So have training and working with children and individuals across the lifespan that have suffered traumatic incidents that may have caused PTSD, depression, anxiety, those types of mental health diagnoses and just doing a lot of trauma work, but not the traditional way with play therapy and expressive arts mostly. And then also have had some clients that have been diagnosed with ADHD or ASD, so being on the autism spectrum. Those are a few of the areas that I have worked with. And also, I just have a big passion for working with parents and equipping parents with the skills to be able to have a happy, healthy home, and to see their children where they are at developmentally, and just even being able to hear, yeah, your child is acting exactly the way that I would expect them to for a 5-year-old. So
Yes.
that's a little bit of, the things that I like to work with, the individuals I like to work with, and a little bit of my history of what I have kind of dealt with clinically.
Yeah, what an amazing opportunity to be able to, for lack of a better word, get our feet wet in such a, looking for the right word, but a delicate, the suffering of right crimes and the trauma that is there, and being able to work with clients, and also loving the fact, right, we're celebrating Latinx community and being bilingual, like being able to provide a cultural component, being Latinx or part of the Latinx community, and being able to help them in their own language. I know a lot of times too how powerful it can be if the children are speak English but the parents don't. Being able to bridge that gap, right? Super awesome. And I also love hearing that you've got some experience working with the ASD community, autism spectrum, and also the ADHD community. Very, very awesome. So it's exciting work to be doing. And I also just wanted to highlight, Sophia, that I loved your mindset and the vision and lens of like supporting parents. And I got excited. I was clapping. I was like, when you said about parents, like being able to give them the comfort of the knowledge that, hey, that's exactly how 5-year-olds act. When they're not sure or what's going on. I remember, I have to say it reminds me of, I remember I myself as a parent and other parents when, kids will do exploratory, they're very young and do exploratory touching when they're playing doctors, and parents freaking out like, no, that is what kids do. And we just teach them boundaries, right? Like, or other things where parents are like, oh my gosh, I don't know. This is, age appropriate, right? So I love being able to help parents through that, right?
Yes.
Let's see. So what are some common mental health problems that you treat, and how have you seen those appear into people's lives?
Yeah, so as I mentioned, of course, like PTSD, depression, anxiety, what I've learned is they look very different for different people. So working with a child that has gone through trauma, or even just having some mental health issues, maybe not diagnosable, but just phase of life transitions, those kinds of things, whether it's problems at home, a divorce, things that are, out of their control. I've come to realize that it may look very different for them and may appear as, reckless behavior, or what we would call externalizing or internalizing behaviors, whether they're withdrawing, whether they're acting out in classes, whatever those issues present as, they all go down to or come down to a root issue, right? And so just being able to provide a space where they feel seen, heard, understood, cared for, and that they can explore and act out what those issues are, that they can just go through that process in an age appropriate way, through play, through expressing, through creativity. That has been some of the most rewarding experiences so far for me, of just someone bringing in, saying, this child is a problem. They're in detention every single day. They're not getting good grades, and being able to say, all right, I don't care about any of that stuff. I just want to see how I can facilitate a space for you to feel safe and to just like work through those problems like we would talking. They do the same thing through play.
Yes, I love that so much. I love how you're like, we're not maybe focusing. I mean, a diagnosis can be important as a roadmap, but maybe not focusing so much on oh, they are this anxiety or they are their ADHD, but focusing on the solutions on helping them process
Yeah.
their internal world through play and how to, helping them be able to role play and make better decisions and
Yeah.
understand themselves differently and build confidence by that tool. So that's amazing.
Yeah.
What about, so we've talked a lot about your role as a therapist as far as giving play therapy.
Yeah.
Tell us a little bit more, like, what does an actual session, what is therapy like working with you and doing the play therapy? Like, what does it look like?
Yeah. Yeah, so it definitely starts with meeting the parents, getting their perspective on what's going on, what are they seeing at home, what are they hearing about at school, what is the bigger picture, I guess, issue and what's going on. And then from there on out, I will welcome the child into the playroom. I will facilitate that space every week. They're about 40 to 50-minute sessions, depending on the child's age, of course. And if they're 5 or younger, that might be 30 minutes, that might be 35. It just depends on what they're able to kind of handle at that time.
Yeah.
And I guess my role in the room is also just reflecting what I'm seeing, saying, I see that you're playing with this thing. Tell me more. Or not even having to ask questions, just being there and holding up a mirror to what they're acting out or behaving or creating, helping them realize that they're doing a certain thing or there's a certain pattern, letting them realize that there's this thing I'm acting out. And then from there on out, around every 3 to 4 sessions, meeting with the parents again, seeing how are things improving, how are things changing, are they getting worse before they get better, just getting to gauge the levels of what's going on. And I'll maintain that process throughout because I want it to be a team. It's not just me and the child and sending them back home to maybe a system that's equally as dysfunctional as every other area of their life. Meeting with parents and having mock play sessions and equipping them with the skills that I would exhibit in the room so that they can continue the work I'm doing in the playroom with their child at home as well. And so it's a collaborative effort for sure.
I love that. I'm hearing so many amazing things from the work that you do with families, the collaborative effort, the providing the parents, a continual, whether it's every 4 or 5 sessions, support, right?
Yeah.
I loved when you talked about the reflective techniques. It made me, I chuckling because I remember I always talk to parents a little bit, an overview of like my child-led play therapy techniques.
Yes.
And because I remember I had a kiddo, I can't remember how old they are, but I guess they had told their parents a little bit what I sound like in the therapy room. And the parents were like, oh yeah, my kiddo says this, right? And I have to tell them that like, well, yes, we're reflecting back what they're saying to us. And I have to give them context of like what that means, right? Or I'll have a kiddo be like, why did you repeat what I said, right? They're like,
it takes getting used to. I've definitely had my fair share of kids look at me like, okay, and what else? Like it's very confusing when they haven't had that experience before.
Right. And then to see them kind of just end up like feeling really comfortable and roll with it. And for anyone that may be watching this that has maybe never experienced therapy at all, or kind of like, what are they talking about? Basically, one of the child-led techniques that Sofia was talking about, child-led play therapy technique, is reflecting like a sportscaster what they're doing. So if the child is like, has a toy car and they're moving it, we're kind of like, oh, you're moving that around right now. I see that. And instead of saying car, letting them label what it is, right? Maybe it's a boat to them, right? Because they're doing pretend play and kind of, or if they're like, I'm so mad right now because this toy didn't, or whatever. Wow, you feel really mad right now. Yes. And so that's kind of the technique we're talking about for those who were like, what on earth are they talking about? Reflecting, and what that help kiddos with is feeling more confident. They feel like they're being heard and supported. their feel like they get to use their voice and make sure that if we're wrong. There's so many just from that little technique, positive effects from that. Did you want to add to that, Sophia?
Yeah, I think that something important to remember is from the moment that children wake up to the second they lay their head on their pillow, they're constantly being told what to do, when to do it, and what is being expected from them. So the child-centered playroom, as you were talking about, is really designed to be that space where they get to decide. They get to decide whatever it is they want to do, what they play with, what they act out, what they don't act out. They can sit there and just draw in silence, and I'll still respect them and care for them the way I would a child that's telling me a whole fabricated story and just needing me to respond back the way that I would therapeutically. And so it is building that confidence, that self-efficacy. Like another technique is returning responsibility. If there's a 5-year-old that's, can you please open this for me? In the outside world, of course, takes it, does it, just, but that's not teaching them that actually that's something you can do. And building those skills of like self-efficacy and I got this, I can do this, I can state my needs, and maybe sometimes I have to do that for myself, or when necessary, I'll do it for them. Just having that relationship of, and here you get to decide, and I'm going to respect that.
I love it. I love it. It's such exciting work. Yeah. Thank you for sharing that, Sofia. What about, I kind of touched on this a little bit earlier, but what are some common things that you see in the Latin, since we're celebrating Latinx Heritage Month that starts September the 15th through October 15th, what are some things that you have seen in the Latinx community with the population that you work? Maybe some stats or things that you've noticed, you've seen pop up a lot that's common, or anything like that?
Yeah, I have a couple of stats that I used recently in a Latinx presentation as well. And these are very, I wouldn't say shocking. They're definitely like eye-opening stats, but they're pulled up right here, so I don't butcher the statistics.
I would do the
same. But I saw online, just overall mental illness, nothing specific, no like specific to anxiety or depression or PTSD, but overall. So if we're talking about the rate of Latinx individuals that seek services, they have found that it's only 33%. And overall, like non-Latinx, that is 43% of people that actually seek mental health services. And so we're already seeing there's a huge gap in between. Maybe it's not available, or the resources are not as great as they should be, or there's a huge wait list, whatever the case may be. Even just not knowing that these resources are out there, not feeling confident to seek those out. Whatever the reason may be, there's a discrepancy between those 43% of people that seek the mental health services, and only a 33% of that is Latinx. And so
yes,
there's something that we have to address, right?
Yes.
Yeah. And then another one was just, it says, so NAMI, the National Association of Mental Illness, says more than 16%, approximately 10 million people in the U.S. Are from the Latinx community and have reported having a mental health condition. So 10 million people. And like we said, some of those are not seeking services. And so part of my passion and desire to enter this field was to start bridging that gap and have more available resources for the Spanish speaking community, and hopefully make that percentage go down a little bit, right?
Yes. Wow. I was shocked by the number when we hear millions, right? Yeah. And I forget what the population in the United States, but I need to look that up. I know it's in the I'm probably gonna say wrong, but I feel like oh gosh, I'm doing this. I'm looking it up. I'm looking up the population. Well, let's see. How many, which I know today I'm using the term Latinx, right? But I'm gonna put in Latinos in case Google doesn't compute, right? Latino, how many Latinos in the USA? Let's see. Okay, 62.5 million Latinos are in the United States since, and this was from 2021 from the Pew Research Center, which accounts for 19% of the total U.S. population.
Yeah.
So 10 million, that's a lot. And think about all the ones that didn't report that they have a mental health or struggling with mental health issues, right? So yes. And I just want to, I don't want to stay too long on this because I know this could be like a great, like all day workshop of talking about like all of the layers that go into why populations, you know, systemic issues, cultural beliefs or narratives that may not be therapy friendly, right? The medical, you know, systemic, you know, United States history of like medical gaslighting or trauma to different minority groups and like all of the things, right? That become a barrier of seeking mental health, right? But thank you for sharing those stats with us. Those were, I was like, whoa, that's a lot, right? So I love these. We're getting close here to last few questions, but I love this question. So for those that are watching this video that are therapists and are working with the Latinx populations, but they're not Latinos, what are some tips? Like the therapists themselves don't identify as being from the Latinx community, but they're working with the Latinx community. What are some tips, strategies, or cultural considerations, anything in that, you know, category that could be helpful for them or mindful during treatment services?
Yeah, I think the number one that comes up for me of just a helpful way of being as a therapist that doesn't identify or belong to the Latinx community is just cultural humility and knowing that you don't know everything there is to know about therapy. I don't know everything there is to know even about play therapy. And so just knowing, yes, I may have had this technique work with a client. Maybe they are Caucasian or Asian from a different culture, and just knowing, be humble enough to know it might not work with someone from the Latinx community. If that technique doesn't align with their values, with their goals, like you were saying, cultural implications. Like I read a lot of articles about familismo and how that can be positive, it can be negative, it can have both, you know, effects on a single person. But knowing that just put whatever you have tried and tested, I guess, and have had like positive results, put that to the side and just approach every person that you meet as a blank slate and know something might have worked with this person, this might not work with this other person, and that's totally okay. Just being humble enough to know that and be curious, just be extremely curious and get to know what their needs are. Asking questions, don't be afraid of being wrong. Just make them the expert on their lives, on their culture, and just be curious overall. Let whatever it is, let them prove you wrong. Maybe that's what they need.
Yeah, I love that. Those are so valuable, those tips. Like as I was hearing you, I was thinking about how I think sometimes we can shy away from, like, maybe if we've never worked with this population before and fear around, I don't want to offend them. And so I love just being humble and being curious and just asking, right, in a very curious way, and let them know, like, you are the expert in this, right? Like you are the expert in your culture and your life, and I want to learn, right? I love that so much. And I love just like treating it like a blank slate because you're right. A lot of we are taught from a westernized perspective, and one shoe, you know, what is that? One size does not fit all.
Right.
You know, we were talking about, I can't remember who I was talking to, another clinician, or about Suicide Prevention and Awareness Month in September, and about, like, you know, I was checking out some local conferences or workshops, and I was curious of how many of these places were providing, you know, resources, suicide resources and awareness and prevention through a lens through certain populations.
Right.
Because it's not a one size fits all.
Right.
Right. Although they can be very helpful strategies, how do we apply this to different cultures? Right. So that was really, really powerful. Those are great tips. last couple of questions is that for anyone who is from a family background that may not be as therapy friendly,
Yeah.
or just maybe just was kind of fearful around going to there, or I don't know what to expect, right? What would you say to them so that to encourage them to give therapy a try?
Yeah. So I kind of give this, comparison of approach therapy the way that you would if you start to get a scratchy throat. You start feeling something, you don't know what it is yet, if it's strep throat or an infection, or you don't have answers yet, but you just know that you need to talk to someone and figure it out. And preventative care is always going to be more impactful than having to remediate later on when it might feel like it's even a bigger problem now. How do we tackle this all at once? And so prioritizing mental health as much as we do our physical health, the medical side of things. Because also, as therapists, we know wellness is very complex. It's not just getting enough sun each day. It's not just talking to our friends each day. It's all these different components, and mental health is a huge part of that. And so the system, our bodies, our wellness can be all out of balance if we only focus on one part of that. And so, in another stat I read recently was that the two highest, I guess, most prominent ailments in the Latinx community is diabetes and depression. And yet, I know for a fact that we're seeking help for diabetes more than we are for depression. But those are the two highest issues that go on in our community. And so it's just putting that out there and saying, why don't you come see us before it gets to be too much? Or even when it is too much, there's never a wrong time to go to therapy. And so I think that mindset, let's start reframing that mindset a little bit.
Yes, I love that. I also was thinking, a lot of times, and I'm Mexican American, so I can't speak to all branches of the beautiful umbrella of Latinos.
Yeah.
But I know for my own culture, my own broad Mexicans, and then Mexican and Mexican Americans, and then like growing up in Texas as a they used to call me, La Tejana, right? Like the Texas girl. But I didn't grow up in a therapy friendly home. There was lots of medical trauma in Latinos and culture minorities in Texas throughout the 1900s, right? I mean, early, and that was carried on in my family. And then also lots of like, you're not going to go to the therapist unless you're crazy.
Yep.
And I know that there's other cultures who are shaking their head who might be watching this saying, yep, that's our culture too, right? And so breaking that narrative of, no, you don't have to be crazy. And it's okay if you are a little crazy. Like, like, it's okay. Like, and I'm using on that, but you know how they use the term crazy as so dehumanizing.
Right.
But like, yeah, we all need help. And even like going to therapy, like you said, isn't just about like, oh, I got to wait until I'm so clinically depressed I can't get out of bed. But it starts with stress, feeling stressed, having someone to talk to.
Right.
I go to therapy weekly some seasons. Right now I'm in a season of I go every other week.
Yeah.
I've been in a season where I go one time a month, but I love therapy. It's how I maintain my sanity.
Right. Yeah. And sometimes we need that professional expertise that our family and friends, or even pastors or any other people that we go to in times of trouble, they don't really have that. They just simply don't have the training, right? And so it is getting a different perspective and skills and support you can't really get that anywhere else.
Yes, and I love for our Latinx people who are watching this, right? Also, let's just be like, going to therapy. You don't have chismosos, like no one's gonna be repeating down the telephone line of what they heard you said, So you get a private space to say whatever you want to say, and know that is not going to get to your family,
right?
Like, and I think that's a beautiful experience, But thank you so much for sharing that. And then the last question of this interview is, I love this question. What does it mean for you to be part of the Latinx community, or what do you love about being, Latina and being part of the community? And no right or wrong answer. Just what is it like for you?
Yes, yes. So
What
I
is
wrote
it like
down.
for you?
Oh, I'm sorry. I cut you
Oh,
off. Say the last one again.
Oh, just like I was just kind of expanding, like, what does it mean for you? What is it like for you? What do you love? Just like all the good vibes about being Latina.
Okay, yeah. I wrote down 3 things. I said being a Latina woman to me means pride, honor, and poder. Whether we came from the same island of Puerto Rico that I was born in, or a totally different country, and we share the same language, I truly believe that we all share the same persistence, the same resilience, the same just initiative to be better for ourselves, to do better for our community, to be advocates for each other. And that's something that I feel empowered by, of just, I'm so privileged to be in this position where I can hopefully use my education and my experience and my training to be able to start bridging that gap. And like we were talking about, you don't have to fit into this mold of being crazy to go seek services, to have support for you and your family, and advocating for our rights and our needs when it comes to mental health. And so I just feel so empowered by the community, and I hope to do right by the Latinx population and do something good, whether it's in this lifetime or the next. Whatever that may mean. I love being able to have call this population family.
Yes, I love that. I really loved, and you are doing that, Sofia. You are bringing hope and healing to our communities, Latinx and others, by the work that you're doing and just who you are. So that's so awesome. I just had to say that I loved the, I forget exactly the word, but I think you might have used like perseverance or resiliency. I love that so much, because I think of the Latinx community and our history on Earth, and how, not to go off on a tangent, but like when we think of colonization and what our communities have experienced, and the fact that despite all of that, we're still here, and the resiliency of our community and our ancestors and all of the things to still persevere. I get so connected to that idea, which is just really powerful. Yeah, I love it. Well, we are at the end of our questions. Thank you so much, Sofia, for participating, and I'm so excited how the community will get to learn more about you and your services, and in the information at the end of the video, in this video, and all of the places this will be posted. You will see how to get counseling if your kiddo is in need of services, whether you're Spanish speaking or not. You will have all the contact information to get started with Sofia.
Yeah. Awesome. Thank you for having me.
Yeah.